Most of the physicians that talk to people tell them what they think they know. They don't realize that it's a metabolic disease. It's not a genetic disease. So, and I don't think they know that. They haven't been trained. The field, majority of people in the oncology field are not aware of that. And it becomes clear when they discuss this with their cancer patients. So if a person doesn't really know something, that would be lack of knowledge, not related to actually lying like these politicians do. Okay, so we know that. The great tragedy in my mind is the therapies that are offered to cancer patients are based on the conventional knowledge that cancer is a genetic disease. When you look at radiation and poisonous chemicals, we all know, everyone, even the oncologists, know that that's not good. And there, by the grace of God, you might survive these very, very toxic treatments. Those toxic treatments were supposed to have been eliminated with the promise of the genomic investment in cancer. We've spent $100 billion on the Cancer Genome Project. The promise of the genome investment has not been coming, and it won't come because cancer is not a genetic disease. So, we have to continue to rely on very toxic treatments for cancer because the promise of the new precision medicines and personalized therapies have not been realized. We have almost 1,700 people a day dying from cancer in this country. That is about 70 people an hour. So in this discussion that we have, 70 people will be dead from cancer. Okay. And that just came out. We have cancer statistics just came out the other day, 2024 cancer statistics. And what they said is we've reduced cancer deaths by 30% since 1991. And that's because the anti-smoking campaign was started in 1991. So had we all continued to smoke, we would have 30% more cancer deaths than we have right now. So this doesn't speak to new therapies for people that already have cancer. It's the prevention. So if you stop smoking, you'll prevent a lot of different kinds of cancers. And people look to that as if we're making major advances in managing cancer. And the fact is, we're not. It's an abysmal disaster. It's probably goes down as one of the greatest tragedies in the history of medicine. And it's not, and nobody's lying to anybody. They just put all their eggs in a singular basket, and that basket happens to have a huge hole in it. And we're not getting the benefits of all the billions of dollars that we have invested in this disorder. And that means, so the theory under which the disease is viewed and managed is incorrect. It's a metabolic disorder. And once you realize that, we'll be able to drop the death rates by 50% in 5 years. But you have to overturn a monstrously powerful system and paradigm. And that's not going to happen anytime soon.